Good morning. My name is María Isabel Cañete. I'm podiatry student at the University of Málaga. And today I'm going to speak about the fungal feet infections with my Antonio Pablo. What is a fungal feet infections? Well, infections are caused by fungi. Infection very common in the fingernail or toenails, particularly in adult people. They usually nest in humid and hot area, which makes the feet a perfect place to subsist. So fungal nail infection can need a long time to resolve. For this reason, you must ask your podiatrist and ask the appointment with him. Firstly, what is the step that you need to follow for the treatment? Well, firstly, introduce yourself. This is the first point. Introduce yourself and identify your patient and gain consent to speak about their personal data before start with the anamnesis. Obviously, you are going to need to take notice as you proceed, so ask the patient's permissions to do it. Secondly, taking a medical history from a patient is a skill necessary for examinations. Important question will be drug history, other medical problems, or the family background. These questions are more general, but it's necessary if you want to have a good diagnosis. Finally, the anamnesis questions. The anamnesis questions, you need to find the useful information that you can about the specific condition to complete their medical history. These questions are more specific about the pathology that has your patient now. What kind of question do you need to make if you want to check the patient conditions? Well, here I put in the Socrates method. The Socrates method is 7 questions that start with the initial letter of the Socrates name. So the first one is site. Where exactly is the problem? This question is more located. The problem, the pathology. For example, is on the nail, on the skin, under the nail. Where exactly is it? Onset. When did it start? Was a constant, graduate, suddenly? I mean, is something that happening now, or maybe it start 2 days ago, or this morning when you wake up, you saw your feet and you think you thought that in this moment, what happened on my nails? Or something that's suddenly now. Character. How is the pain? Or how do you feel today? This question, obviously, if you don't have pain, you can use it another symptoms with this question. If you feel itchy, for example. Radiations. Does it radiate? Move anywhere? The meaning of this question is more that the pain is in the same side all the time, the same point, or move and come in and go. This is the meaning. Associations. Is there anything else associated with these conditions? For example, sometimes you have a reaction with the nail polish, or maybe some chronic medical conditions increase the risk of your toenail fungal infections. Or if you have diabetes or has other illness that maybe compromise your immune system or interfere with the blood flow, maybe you has associated these kind of elements with your pathology. Time course. How long did it start? Had you had this problem before? Fungal infections can be affected by heredity, and some families are more prone to it than others. Obviously, you can if you have a families with these kinds of problem on your feet, on the foot, sorry, on the feet, um, obviously it is more prone than another one. Exercise factors. Do you practice an sport? Usually, it's you practice sport like the swimming pool or running. You have more probabilities that has infection on your nails, uh, So you need to drive so good between the tones. Um, Try that the has a hygienic, correctly hygienic on your feet. So if you have, for example, a narrow shoes, or you like running in the morning, but your shoes is not probably the best, maybe you can have some trauma to your toenail. So this is probably that weak the nail in the short time in a short time. So be careful with this one. Severity. How severe is the pain? Consider using from 1 to 10 scales. This question, like the one of them, you can use it with other symptoms. The point here is to know the levels of the pain or another kind of symptoms. So for the next step is the symptoms of the fungal infections. In this case, is my colleague Antonio is going to speak about that.
Hello, my name is Antonio and I'm going to explain the symptoms of the two different types of fungal infection in the foot. The first one is the dermatomycosis or superficial mycosis. It occurs on the skin and it's very usually located between the toes and the sole of the foot. It causes a lot of itching, flaking and redness of the skin and a bad smell. It's very easy to find this pathology in people who make sport because fungus usually nest in humid and hot areas, which makes the feet a perfect place to subsist. The second type of mycosis is the onychomycosis. In this time occurs in the nail area, and it's characterized by a yellow-green color, weakness in the tissue, it is very easy to break the nail, bad smell, and in extreme cases, elevation of the nail with respect to the nail bed by fungal spread. Onychomycosis is normally a result of a superficial mycosis spread to the nail area. So when there is an onychomycosis, it is almost certain to also find a superficial mycosis, but not in all cases. Next, I'm going to give some information about prevention and some podiatric advice. It is very important for the patient to know how to care for and prevent this type of pathology because it is very contagious and difficult to remove. About 1 month to eliminate it completely. Okay, the first step uh, is to keep the feet and shoe always clean. Wash them often, especially after sport. Second step is dry your feet with a towel to avoid moisture. The third one, use talcum powder, preferably with boric acid. Boric acid is a fungus killer, so if we mixed it with talcum powder, it's gonna be more effective. Okay, the fourth step is do not share the shoes with anyone. It doesn't matter if it's your brother, your sister, your son, it doesn't matter because we don't know if that person have a fungal infection. So better do not play with that. Okay, the last one is wear some type of footwear in swimming pools, public baths, etc. We are in the same example than in the fourth step. We don't know if the person that was walking for there before hours it's infected with a fungal infection. So it's better to prevent that.
Hello there, my name is Pablo. I am podiatrist and I'm going to talk a bit about the treatments that we can apply to heal the fungal disease that in many occasions we can suffer. Specifically, I'm going to talk about the fungal nail and its treatments. First of all, we have to say that treatments depend on the severity of the condition and the type of the fungus causing it. It can take months to see results, and even if the nail condition improves, repeat infections are common. Having said this, we have to differentiate between two kinds of treatments, which are the professional care and the home care. Both are destined to the same goal, the nail healing. Starting with the professional care, an important tool is the medication. We can find three different kinds of them. Medicated nail polish, which is indicated to paint it on the nail during a period of almost a year. Oral antifungal drugs, they clear the infection more quickly than do topical drugs. And this treatment may cause side effects ranging from skin rash to liver damage. And at the end, the medicated nail cream. This one helps the medication get through the hard nail surface to the underlying fungus. Another option for the treatment of a fungal nail is the surgery. In this case, the professional prefers to remove the nail in order to apply antifungal drug directly to the infection under the nail. This treatment will make so higher the probabilities of heal the nail. And at the end, we also have to talk about the home care that we can practice in order to heal our nail. At home, we can trim and thin the nails. This helps reduce pain by reducing the pressure on the nails. Also, doing this before applying an antifungal, the drug can reach deeper layer of the nail. So that's all about the treatments. Thanks for your attention and see you soon. Bye.